Hi, Steve Adubato here, talking about every conceivable aspect of this global pandemic. Late in September, we're joined by Dr. Suraj Saggar, who is, in fact, the Chief of Infectious Diseases at Holy Name Medical Center. Good to see you, Doctor.
Steve, thanks for having me. I appreciate it.
You know, so much misinformation, so much confusion. We are in the fall season. It'll be seen after we're taping at the end of September. Let me ask you this. How much trust should the public have in the messages coming out, not just from political and governmental officials, but from public health officials in governmental posts, including the CDC? Complicated question, I know, which often seem contradictory and confusing.
You know, Steve, I understand the public's confusion. This is the first pandemic in the social media era. There's so much information coming out. So it's almost like an infodemic, right? Where is the information coming from? Which do we trust? Which we don't trust? Obviously, it's an election year. There's a lot of political division. So, you know, I always say, as a scientist, us in the medical community, as a physician, you know, we just rely on the science, right? We try not look at emotion, not look at politics, just look at the science and the data. And so I think the public out there has to understand very clearly that the scientists and those out there are out there for just one purpose, and that is to better understand this pandemic, better diagnose, treat, and save lives. And so I think it's very important that we garner the public's trust, especially with the hope of a vaccine on the horizon. You know, in the latest survey, 1 in 3 Americans would not take the vaccine if offered. We really have to do and make sure we continue to do an excellent job of educating and keeping a consistent message. And again, confirming to the public that indeed all our decisions are based on data and science. Because again, we live in an evidence-based world, and that's how we practice medicine.
Well, doctor, let's do this. I cannot believe we're taping this 6 to 7 months into the pandemic. Excuse me. And there's still some confusion on the part of some people. There are some people watching right now who believe the math thing is some sort of, dare I use the word hoax, that it's overrated. Clarify this mask thing, which I'm embarrassed that we even have to talk about.
You know, it's really important we talk about it, because if we look at how this evolved, and this is really an evolution of our understanding of COVID-19. In the beginning, we weren't so sure masks were necessary. We were much more concerned about washing our hands, wiping down our mail, wiping down our groceries, our takeout, et cetera.
I just got my hand sanitizer here. It's not either or, right? Go ahead.
You know, we want all of it together. But if we look now, if what's more important or the most important, masks are extremely important, because we're understanding now that transmission is less about contact, so less about my hands, and more about droplets. So when I cough, when I sneeze, when I talk, that these droplets go in the air. In general, they spread about 6 feet and fall to the ground. Hence why we always tell people 6 feet social distancing. But we do know that there's at least a lot of data coming out now, especially in the last few weeks, that some of this virus can be aerosolized. What does that mean? It becomes airborne.
Does it stay in the air for a period of time? Does it just drop to the ground? Help us understand that.
Yeah, so, you know, the larger droplets, because of their weight, will fall within 6 feet of expulsion. So if I cough, I sneeze, they'll travel 6 feet and they'll fall down. The airborne component is that they're so small, they can float for long periods of time. They can get to the air conditioning ducts, the HVAC systems, et cetera. And that's a much more concerning issue. We see that with things in the infectious disease world, like measles, like tuberculosis. Again, the mask is there to mitigate the spread of those droplets and or aerosols infecting other people. So we're understanding that it's actually very important. And I will tell you, Steve, that in the beginning of this pandemic, we probably, as a health and medical community, did not do a well enough job of utilizing and requesting masks for the general public. And that's, again, a reflection of our evolution of our understanding. Remember, 9 months ago, none of us had even heard of COVID-19. December 31st, the Chinese reported WHO, and then we're off to the races. So this is science in action. This is the evolution of our understanding in action, and we have to expect that some things will change over time.
And let's also clarify that Holy Name has seen, particularly early on, the worst of this pandemic. Other hospital systems as well, but I mean, really rough there. Let me ask you this. The vaccine issue. We hope, we pray, we knock on wood. What does the public need to know and believe in before someone says, yeah, I'm in.
Right.
I'll be first, I'll be second, I'll be in the first wave?
You know, Steve, such an important question. We're in phase 3 trials, 3 major pharmaceutical industries in phase 3 trials in North America. We need the public to understand that the process is going to play out. It will not be approved until the efficacy, that means it's effective, and safety is outlined. There's not going to be a hard date. obviously by an election, by December 31st, by the end of 2019. So I think we need, and that's, it's been unprecedented.
2020.
2020 to 2021, excuse me.
This is a year some of us want to forget as well.
It's been a busy year, so this year's been a blur like a lot of people. So, 2019 flew right into 2020. But, this has been unprecedented where the pharmaceutical CEOs have signed a statement, very strong statement saying this process will play out, that no vaccine will be approved until we absolutely are sure it's both efficacious and safe. Now, when people say that they've heard, well, I heard the phase 3 trials might be shortened, that happens all the time. If the data is overwhelmingly supportive that a vaccine is effective and safe, then yes, they may shorten the trial and then go towards FDA approval. But I think we absolutely have to reiterate this over and over again to the general public, because look, influenza, which requires a vaccine every year, only about 45% of the public gets it every year. So we have a problem in this country, I think, of understanding just how important vaccines are. And I'm a huge vaccine proponent, as you might imagine, in the infectious disease community and my colleagues. But if you look at all the different medical interventions since the beginning of modern medicine, the amount of lives saved does not even equal that altogether versus vaccines. So people have to understand the importance of vaccines, how it's really just changed the scope of modern medicine, how many lives it's changed, how many pediatric and childhood diseases it's eradicated. And again, just look what has happened around the world with a virus that had no natural immunity and no vaccine. Now we're all clamoring for a vaccine. We understand the ideas of herd immunity. So again, it's so important for us as physicians, and we're so appreciative of the media to continually educate and get the word out to the general public.
I want to be clear that Holy Name's involved in several clinical trials. Regeneron, right?
Absolutely. So that's very interesting. It's a monoclonal antibody, fancy word. Basically just an antibody that essentially binds to a part of the virus, what we call the spike protein. So imagine a circle and little spike. That spike is what binds to receptors in the cell, in the lungs, in the liver, in the pancreas. If we can just bind and neutralize that little spike protein on the edge of the virus, we can negate it.
And by the way, go on to the Holy Name website if you want to find out about the other clinical trials going on there. Doctor, I want to say this on behalf of all those of us who are out there and have had loved ones or ourselves have been affected by COVID, to you and your colleagues, not just at Holy Name, but of all the healthcare organizations, all the hospitals. We cannot thank you enough. People called you heroes when it really was bad in New Jersey, and we hope it never gets that bad again. But I'll tell you what, you'll be heroes for a long time after this. And I cannot thank you and your colleagues enough. Thank you, Doctor.
Steve, thanks so much for having me. I appreciate it.
You got it. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the New Jersey Education Association, the Russell Berry Foundation, MD Advantage Insurance Company, the Northward Center, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, Valley Bank, Berkeley College, and by promotional support provided by NJ.com and by Jaffe Communications.
The essence of the Northward Center is ingrained in our values, thoughts, and actions. What began as a storefront on Bloomfield Avenue has evolved into a life-changing community nonprofit. The mansion is steeped in tradition, but with all of its grandeur, the true essence of the Northward Center is in the people we serve. So as the Northward Center commemorates 50 years of service, let's also celebrate the many opportunities yet to come.